always has to remind me to record the session. The amount of times in the past where I've sort of like got a couple of minutes in and thought, oh no, I haven't pressed the button.
And
So,
it's
well,
on, so I'm going to mute myself.
no problem. So, welcome everyone. It's really nice to see everyone sort of attend as normal. I appreciate it's half term, sort of many people who couldn't sort of like attend today, but we record the session as normal, which will be sort of uploaded. And we have a wonderful guest this morning. We have Aimme Webb, who is our wellbeing worker and mental health lead here at Carer Support West Sussex. And Amy has got a lovely presentation for you. And if there's any questions after, if not putting Amy on the spot, but if there's any questions after and Amy needs to sort of get in touch with you, are you happy for us to sort of pass on your email sort of details? And you know, sometimes it's hard when you put on the spot sort of with questions, but hopefully through the PowerPoint presentation, all will be explained. So that's enough of my rambling this morning, and I shall pass you over to Amy. Over to you.
Brilliant. Thanks, Mike. That was a really lovely intro. First of all, I'm going to apologise because seagulls have just turned up on my roof, obviously, because I'm having a meeting. But bear with me. I'm just going to share my screen. Okay. Can everyone see that?
Yep.
Yeah.
Yep.
Brilliant.
Yeah.
So, like Mike said, I am the mental health lead for Carer Support West Sussex, but also work as a wellbeing worker in the North team for Chichester and Horsham. So what Mike has asked me to come and speak about today is how we support our mental health carers, support someone with their own mental health needs or for their own mental health at the end of the day. Okay. So we support mental health carers who are supporting someone over the age of 18. They don't need to have a diagnosis of a mental health condition. We do obviously, because it's obviously big at the moment about young people's mental health, so we do support those carers as well. They just come under a parent care category rather than the mental health. Right. So mental health carers often have their own challenges, which some of them are listed here, and I've added a few more today because these are things we've heard from groups and that we know about when speaking to our one-to-ones. So actually a lot of our mental health carers are supporting someone with co-occurring conditions. So that could be autism, mental health, have neurodivergent needs, or drug and alcohol use, such like that. The wait times for support are a big challenge, as I'm sure all of you are aware of. They're dropping off the radar after a crisis. A lot of our carers feel that all of a sudden they're bombarded with support, and then once that kind of crisis period is over, they feel like they're kind of back to square one and there's nothing out there for them or the person they're supporting. A lot of our carers say they don't feel heard by professionals, whether that's in primary or secondary care, whatever service that it may be that they've tried accessing. A lot of our carers have these fears. Maybe they don't understand the diagnosis that the person they're supporting has been given or how to help them. They feel that they're doing it wrong or not doing enough to actually provide support. A lot of them feel they're kind of really out of their depth due to kind of that lack of the basic knowledge and understanding of condition, let alone how to kind of help the person they're supporting, because obviously not everyone with schizophrenia is going to exhibit the same or have the same needs. There's a lot of feelings of powerlessness, and there's always big conversations about acceptance of what our own capacity is as carers, what we can actually do and what we can't, and that can be really, really hard. A lot of carers that I've spoken to have had really traumatic experiences when supporting their cared for person. Whether that's they've gone into crisis and something completely horrendous has happened, or kind of that secondary trauma as well. And a lot of our carers don't actually recognise that. So, you know, crisis services are involved in bits and pieces, sometimes police, other services, hospitals, and it takes them time to process that too. But what time do they have to process that when they're already back into supporting that person? Okay. The other thing we've found is that some of our carers don't know what the service the person they're supporting is actually under, or what they actually offer. So I know this does bring into that whole confidentiality, but there is a carer's confidentiality policy under SPFT on, you know, consent and such like. But you can still know the basis of a service without knowing what they're strictly offering the person under it as well. And that is as a bare minimum, some carers just don't know, which can make their role 10 times harder. So obviously, a lot of people are feeling bounced around those services as well. So kind of you're going flitting between primary, secondary, and everything in between. And then you have the co-occurring conditions where some services for like drug and alcohol are saying, well, actually, you need to deal with that first, or vice versa, which can cause challenges, even though there's the new Essex protocol around managing both and having that person-centered approach. And then obviously the GP knowledge about mental health varies tremendously, and there are different offers within different surgeries, which can be challenging when carers come to us and we're like, well, why weren't you referred to that service that's kind of in-house? And they're like, well, we didn't know about it. So there's all these things, and this list isn't, you know, exhaustive. This is just what we hear in the groups and from carers that I've spoken to prominently. Okay, so I'm sure that, you know, when you put in other worries like finances, housing, their own well-being, it's no wonder that it does become a lot for a person to manage. Okay, so yeah, so just kind of an idea around well-being, because one thing with supporting someone with mental health needs is the provisions for respite are a lot more limited than for other conditions as well. So more than 57% of carers responding to the survey said they felt overwhelmed the majority of the time, and over a third said that their own mental health had suffered because they're not getting that support or respite. So I just thought that was quite interesting. Okay, so this is something I've taken from the training that we provide to our staff as the bare kind of bones of what we want to provide to our carers. So we're listening to hear people and not just to respond, which is really important when carers are feeling they're not being heard or validated, or their experience is not being seen or anything kind of done about that. So that's our bare bones, is that we need to be there to listen, to hear, and be present with them. So we have a strong focus on what we actually can do, because obviously we are not a mental health specialist service. We are not a crisis service. So we focus on what we can do to provide support in that moment, in that month, in that week, or whatever. We are the expert in carers, not specifically in mental health. So we will do everything that we can do that is within our remit. So we do that by being aware of the other services, whether it's kind of primary, secondary, how we navigate those, how we can get in the front door of those so that we can support carers in that process. We utilise our own toolkits that have been created by ourselves, as well as the one from SPFT around mental health signposting, which I presume you guys will be aware of. We have our own specialist group. We have to make a point of discussing a carer's own well-being, because more often than not, you speak to a carer and they're like, this is what I do, this is how I support this person. And then it can occasionally be quite difficult to bring it back and say, okay, but what are your main concerns? What are you struggling? What do you need? What are you hoping to get from this conversation? You know, what is going to improve your well-being, your own mental health, your own physical health? And we navigate things from there. A lot of experience I've had in planning for these emergencies. So a lot of our mental health carers sit there and say, well, actually, it just feels like we're waiting for a crisis, and then the crisis hits and we don't know what to do. So then we're kind of trying to navigate and make plans with people. So a lot of mental health carers will say, oh, well, I can actually tell when this person is going downhill. Okay, document that. Okay, because you have all the knowledge. But sometimes you go into a room with a professional and it kind of all goes a bit out the window, or it's overwhelming, or it's a lot. And professionals can be quite intimidating, you know. So we're talking about documenting that. Who is the lead practitioner? Who is the main person involved in their care? Who can you call when that crisis happens? Make that plan for them, but also make that plan for yourself. So what happens when that person goes into crisis? Who can you call as the carer for support? Is it another family member? Is it this service, that service, Samaritans, bits and pieces like that? Just to, obviously, we can't stop there being a crisis in most cases, but we can, in a sense, kind of ease that experience. So at least no one's left in complete overwhelm, floundering around, but I don't know where to go when those huge, big moments hit. And it is a lot about empowerment. And we do talk a lot about information sessions that we provide and training opportunities across other organisations like West Sussex Mind, Recovery College and such like. Because having more of a that baseline knowledge can mitigate a lot of fears that our carers have. And we're also very mindful of that living loss, those changes in relationships, those changes in personality and things like that, depending on the condition. And that can be really hard, and that can actually kind of kick off that grieving process while that person is actually still around. And like I said about the trauma before, of some situations where it's just been a completely horrific experience ultimately. So this is how we support carers at Carer Support in a very, very concise nutshell, okay? Because I don't want to go into everything we provide at Carer Support because we'd be here a long time. But ultimately, the third Wednesday of every month at 7 o'clock in the evening until 8:30, we hold our online mental health carers group. What I always do say is if someone struggles digitally, it is done via Zoom, and we can provide support via our digital champions in terms of accessing that group as well. Okay, so we offer various talks, information sessions, wellbeing events around promotion of wellbeing and mental health. So I just had a kind of example here in that one that we previously done with West Sussex Mind was creating WRAP plans. So they call it Wellbeing Recovery Action Planning, but we were doing WAP plans, so Wellbeing Action Planning. And we were doing that with our carers so that they could have that kind of tool there to create those kind of plans, safety plans, supporting wellbeing for the person they support and for themselves. But there's lots of different ones we've done around self-care, mindfulness and such like as well. We have speakers into our groups when we can from services like Staying Well, Triangle of Care and such like for information for our carers. We have 2 toolkits which are accessible on the website. One is mental health, which kind of does what it says on the tin, is all things around mental health, mental capacity, section 117 aftercare, after sectioning, and kind of that help and support from like those Pathfinder services via area. I know that's changed of recent, so we'll see where we're at, and we do regularly update and amend that. Well, I do anyway. We also have our suicide prevention toolkit, which again is there for carers supporting someone with suicidal thoughts or intent, but can also be helpful for themselves. And it's kind of handy to have on that back burner because it has lots of kind of different resources around safety planning, information, who to call when as well. And I think a bit of kind of information and understanding can sometimes make that less scary for people as well. You know, how to talk to someone who's feeling suicidal. It's those skills that I think a lot of us take for granted, that when you're suddenly supporting someone with that, it can be scary. And like I say, you don't want to do or say the wrong thing. We have a quarterly newsletter specifically for mental health carers with information and events from other services as well as our own. So if there's any new training opportunities, different information, like the ethnic minorities carer forums and bits and pieces like that, we add that in so that carers can see, as well as any kind of, the word's lost to me. It's not a quiz, like feedback around mental health services and things like that. So we'll also put those in so carers can access and look at different opportunities for making sure their voice is heard. We have one-to-one conversations with our carers around their own mental health and well-being so that we can offer support as well as their care involved. We don't hold the caseloads, but we'll offer additional calls if required, because we know obviously a lot of these cases and these experiences can be quite complex. And where possible, we would make it so it's that same wellbeing worker if you're following up that conversation with someone. We do direct and refer to more appropriate services nationally or locally as well, and make sure that we're keeping in guidance with the SPFT re-signposting. We provide information and resources around conditions for carers to gain more understanding, feel they're more prepared and less fearful. Can meet carers face to face if there's an evidence need, so if there's anything around hearing themselves they're anxious or they can't because they're always with the person they support, and we can do this via community or our hubs. And then, like I said, it's about being there to listen, validate that experience, hear those frustrations, even if there's not much that we ourselves could do in regards to that situation. Navigating services, we do provide funding that could facilitate one-off respite on occasion, planning for the future, and then accessing services internally. So then we have got our carers assessments that we can provide based on areas. Carer coaching, funding, energy advice, contingency planning, benefits, digital champions, check-in and chat, equipment, the list I tend to go on. We've got our carer learning and wellbeing programme as well. So it's definitely worth checking out what we have on offer at the moment. And this is just, you'll be pleased to know, the last slide. And this is just about our professionals page, which does have information for you guys, training opportunities. We can provide those carers awareness sessions, keep losing my words. And it also has kind of our most up-to-date leaflets and such like, as well as the links to refer, although carers can self-refer as well. Although in my experience, if this kind of 2 seconds to fill in this as a professional yourself can mitigate a kind of whole weight of just the process of thinking about it, doing it, and all that anxiety that can come with it in a self-referral can be huge for our mental health carers. Okay. I know that was really kind of quick off the bat, and I know Mike and Caroline, I can send them the PowerPoint for you to kind of review and look at afterwards, and I'm more than happy for my email to be shared. But did anyone have any kind of initial thoughts, queries? Have I just all shocked you into submission?
That was a brilliant presentation. That was really good. And we have a question from Freddie.
Hi, Freddie.
Hi, Amy. You all right? That was brilliant.
Yeah,
That was a really good presentation. Thank you so much for that. I was just wondering if you could take us through the carer's journey from the point of referral to then getting through to your team. What does that kind of look like?
Oh, the pressure's on. Okay, so ultimately, I'm sure Michael Caroline can correct me, because obviously I work in the locality team. So initially, the carer would come through our helpline. So the referrals that you make will come into their queue and they'd get a call back. First contact will be made by them to see if there's any kind of quick support that can be offered or if they need more. And then they'd go to the next most appropriate team. Usually, I believe, unless it's hospital team or carers assessment, they would come to localities.
Correct.
the localities are north and south. So you've got Chichester and Horsham and Crawley and Mid Sussex as the north, which is the team I'm generally in. Then you've got Arronada and Worthing as the south. They'd come to us. We'd provide that wellbeing conversation, see what we can do to support, direct them to, such like provide, complete the funding, things and bits and pieces, and see what the next steps would be. So if they wanted that carers assessment, we'd then send them to carers assessment team, or if they wanted the funding, we'd send them for the preventative assessments to the same team. Or if they wanted coaching or energy advice, we'd move them over to those teams. And if after having those conversations with those teams, they needed further support again, they'd come back to the locality. They wouldn't have to go back around and start back at the helpline.
No.
So they'd come back to us.
Nice. Yeah, that sounds good. So you're not the end point. You're actually quite early on. Yeah.
Yeah.
Awesome.
Yeah.
And it's very carer led, isn't it? So wherever they are in their journey, depends sort of what support we're sort of offering them. You know, some people may just want to register because it's peace of mind that they know that we're there in the background, and other people will want to speak to, you know, Aimme or a specialist worker or someone within their locality team, someone who knows the area where they live. So yeah, it is very carer led.
The other thing that I would say is that some of the questions we get asked is, well, what if I register and then don't speak to you? And what I've said to people is that I know our systems change and things like that, but I've, you know, spoken to a carer that it turns out she's been registered for 10 years and she's still there. She's still registered, she's still on our system, and we don't kick anyone off just because they haven't interacted. We are still there for that peace of mind where you can call any time. And we do support afterwards for generally up to a year as well if there is a bereavement or you stop that caring role. The other thing is that whilst the mental health specific group is online and only that once a month, we are applying for funding to look at a face-to-face opportunity for that. But we do also have our open to all carer groups across West Sussex, which some more than others do have quite high prevalence for mental health carers, but they are all open to all and they are face-to-face, so any carer can come, regardless of who they're caring for as well.
Any more questions? No. Well, thank you, Aimme. Like I say, that was a brilliant presentation and very informative. It even helped me sort of within my role, and I've worked here for nearly 3 years, but it, you know, we're still learning all the time within the organisation. Oh, got a question, Fiona.
Thanks. Sorry, Mike.
Right.
Aimme, just wondering, sometimes clients, when they are talking about mental health issues, can feel quite stressed. And I know sometimes when I have been trying to signpost people to carers support, they were a little bit nervous about talking in the group setting. Now, I know you're saying it sounds like you're trying to do a tremendous amount of things in regards to online and face-to-face opportunities. Is there any words of advice that you can pass on to us, or anything you're finding works really well to reassure people? Are you saying we'll come in and meet me in the hubs, for example, and have a one-on-one chat?
Yeah, I mean, if we've got someone, although it's not a kind of strict offer, but I know in the experience in the past, I spoke to a lady who had really quite severe anxiety, and she was a carer. And even speaking over the phone on that one-to-one was a struggle. So we had that kind of multi-agency approach with myself, someone from West Sussex Mind, and this carer. And we actually arranged to meet in the community at a library or something. So we met her kind of where she was comfortable, but obviously where was safe for us, so that we could have that one-to-one. And I brought all things technology, so we could register her and such like, all in that one session in her kind of safe and comfortable space, ultimately. So that is something that can be offered if anything digital or speaking over the phone, or people are worried or just so completely stressed and broken that they need a bit of that extra hand holding. So things can be put in place, because we rather kind of, I know at carer support that I might get told off for saying this, but we rather go that kind of little bit extra rather than see someone not get the support that they're after or need. Does that answer the question?
Yeah,
very
okay,
well?
thank you for that. Yeah, so encourage them just to make contact with you and speak to you, and then you'll try and engage and find a way through. Great, thank you.
Yeah. And I mean, in terms of obviously like self-referrals, so you guys professionals can make those referrals. We have the online chat service if people don't want to actually speak, if they just want to kind of message or email, or actually do have that first contact and speak over the phone. But if all of those are difficult, we do attend a lot of community events and such like, so it's worth also checking that out on the web page, because if they're more comfortable just going to kind of scout us out and assess who's there and see if that's a face that they feel comfortable talking to at an event or such like, then that's another avenue in as well.
And thanks for that, Aimme. But
Thank you.
and I think it's something sort of like with Caroline and myself, sort of working out sort of in the community, sort of with GP sort of surgeries, and a lot of the surgeries that are organising care events, coffee afternoons. It's a good way of talking to new carers, those that aren't sort of registered with us, if they feel comfortable coming along to them, those sort of settings. I went to one at Lime Tree a couple of weeks ago, Lime Tree surgery, and a carer came with a friend who was registered, and it was her friend that encouraged her sort of like to come in to get registered. So that was really sort of nice. She already had that little bit of support, but she just needed someone to come with her. So again, there are opportunities for the carers to come to those sort of groups outside of sort of carer support, and we are trying to work more sort of within the community and have like carer hubs where a member of staff will be working within a particular locality in the community, and those are advertised on our website, so that carers can have a look and see where they can book in and have a one-to-one conversation with someone. Okay. Well, Aimme, you're welcome to stay. Like I say, we're probably not going to be on sort of much longer today, but which everyone's going, yay.
Well, I'm going to go prepare for a next meeting, but like I say,
Okay.
I'm happy to send out the slides, or even I can't speak anymore, or even my email, so that if anyone does have any of those last questions or something that they wanted to just speak to me kind of on a one-to-one, because I know sometimes groups can be a lot, then do let me know. But thank you so much for having me, and I wish you all well. All right, take care.
Have a good day.
Thanks. Bye.
Bye. So normally we would have a second guest speaker, or we might have a spotlight surgery today, or we might have the lovely Anna that would come and sort of like update you about the sort of services or support available. But unfortunately, you've got myself and Caroline today, and we don't talk as much. So, but one thing we wanted to sort of like put the question out there. Some of you, well, a couple of questions actually. Some of you have had sort of like baseline reviews with us, where we've come out to the surgery and we've had a discussion, and we are trying to sort of like go back to surgeries and sort of see how things are going, what things have been put in place to support carers. I was just sort of thinking, on our website, on our primary care page, we do actually have, I'll show you actually, it's probably easier to show you. This is where I always fail with sharing stuff. So here on our primary care page, sort of within our website, obviously we've got our referrer carer, where you're probably used to that page, and our toolkits. which are they are updated all the time. I was having a look at the information sort of within there. But one thing that doesn't seem to sort of like get used that often is if you would like us, Caroline and myself, sort of like to come out to the surgery to arrange to have a baseline review or just have a discussion about some of the work we're doing. We do have they called it at the time book a discovery meeting. Well, you've already met us, but it might be nice sort of like if you want us to come out again. So the easiest way to do that is to click on the contact the primary care team, and Caroline and myself, depending on what area you're in, we'll sort of pick up that email, and then we can sort of like contact you to arrange sort of like to come out for a meeting. The other thing is just to remind you is with our meetings like we have every 6 weeks, like today, they are all saved on this site. So our carer learning set information, every video that we've recorded from when we started doing these has been uploaded. So if you have time, or it's easier just to fast forward through some of the information, and there's a particular bit that you were interested in, it's worthwhile sort of going on there and just sort of checking out some of the previous videos on there. And some of them have got the presentation notes or even the slideshows on there. So it's just really a reminder to use the website a little bit more, just to make sure that you're getting the latest information and that you're getting the support that you need from Caroline and myself. Caroline, is there anything you'd like to add at all to that?
No, only that, we regularly send out just kind of blanket emails to all of the surgeries county-wide, really, just to keep the contact going, I suppose. I mean, I always feel a bit guilty about just blanket emailing everyone, and I hope that you don't, it's a fine line, isn't it? We don't want to bombard you because we know that you're really busy, but at the same time, I mean, we all do it. If you don't hear from someone for a while, they kind of drop off the radar a little bit, and you forget about them. So, if when we contact you, it's really, we're just kind of just trying to keep us up there on the radar and just say it's very friendly. Hello, we're here for you. There's no obligation, but if you would like a little bit of support, please reach out, because we're here to help you in any way that we can, really.
And I think we're quite fortunate in the sense, although Caroline and myself are working on the energy and wellbeing project, we still have time allocated to work within primary care, which, that was an area that we worked in sort of like for 2 years. And particularly Caroline saw it from the start, and was one of the original workers on that project. So we're pleased that we haven't sort of lost that part of our role altogether, because we do value sort of the contacts that we have with you at the surgeries, and we just want to sort of keep that going. And particularly at the moment with the work that we're doing on our energy projects, where we're setting up carers energy hubs, and we've had some sessions that have already taken place from starting sort of like July, August, September, and in October, and they've been really good. I don't know whether if Julie's on here, Julie Bagnall.
Yeah, she's here.
Yeah, hi, sorry.
Hi,
Yeah,
Julie.
I'm
I'm not putting you on the spot or anything. It was just I really enjoyed the session sort of last week that I attended sort of like with your surgery in St Lawrence. I wondered if you had any sort of feedback sort of from carers about that particular session.
Not directly from the carers since then, but I am going to reach out to everyone that attended, because although we did sort of advertise it, the attendance was a little bit poor from the other 2 practices. So I am going to chat to the ones that did attend see what they thought about it. But I felt it was really valuable, and the people that did come really enjoyed it, and also had made connections with each other, and also had got some valuable information from yourselves. And we had the Dementia Hub, didn't we? We were lucky to have them come with us as well. So, but yeah, so next one's going to be bigger and better. So we're hoping to do another one in March. So I shall be in contact with you about that. But yeah, the carers that did attend, some felt it wasn't so relevant because of the sort of dementia connection at that time. But I think if we can get some more other services there that sort of cover the mixture of carers that we do have, I think that might be really helpful to them as well. But yeah, it was good session. Yeah, we're still buzzing from it. Really pleased.
I
Thank
was
you, Mike.
after it. No, I enjoyed it, and it was just nice to see, like you say, the connections between sort of like the carers having those sort of conversations, and you know, some that I contacted after for registration were saying that they just thought it was a brilliant idea and a way of sort of like connecting, and it actually made them feel good sort of about their surgery and what the surgery was actually doing sort of like to support them. I don't know whether anyone else sort of wants to talk about anything they've done sort of within their surgery with regards to the carers groups. You feel free now, or maybe it'll be a topic or something we'll bring up at the next carers sort of a learning set meeting. I think the next one's probably going to be, trying to think, it's probably going to be December, so we'll be getting sort of like nearer Christmas, so we'll have to have a Christmas theme one. We'll think of something. Hannah.
Hannah.
Hi there. Hello. Yeah, so I mean, actually, on the back of working with the Carers Register, I now hold monthly coffee mornings at one of the surgeries, and I have to say, it's not, I don't target it just for carers, but because I speak to a lot of carers, a lot of them do come along, and it is actually really nice because some people are getting quite anxious from being carers, and it's, when I spoke to them, they weren't really very keen on going to like coffee mornings that are in churches or in places they didn't know, but they found it easy to walk into the surgery and go to a coffee morning. So I used to hold them down in reception, but we became too noisy. So now we have to go up to a conference room.
Okay.
So yeah, I mean, I have to say that it's been a really good thing and really rewarding, because it's still really well attended. Having almost done it for a year, we get around 20 people coming.
Wow.
One time we had 25, and it was too much. It was so mad.
But it's having the staff there to support you as well, isn't it? Sort of to run it. So
yeah, well, there's two of us that do it. I can do it on my own, but it is like quite manic. It's, you know, I feel as though my stress levels are sort of like I'm sweating buckets by the end. But yeah, no, it's just a really nice thing to do.
Okay. Which surgery are you with, Hannah?
With the Cookfield and the Vale.
Okay, Cookfield. I know that Caroline sort of had conversations.
Yeah, Hannah and I, we've been to and froing a little bit, Hannah, haven't we? So
yeah, we have.
I'll follow up with you after today's meeting.
That'd be good.
What I think I might do is sort of put a list out sort of the surgeries that are sort of working, you know, having sort of like care events. Some are sort of doing them sort of quarterly because it's how they sort of have to sort of manage them with sort of staff capacity, and others are sort of on board with the Carers Energy Project and looking at sort of doing the monthly groups. But if you're interested to find out what surgeries are doing what, and maybe talk to those surgeries. For example, again, not putting Julie on the spot, but Julie came to the Lime Tree surgery just to see how they were doing things. And it's just about sharing that knowledge and information. So I think that might be something that I will sort of share, just who's doing what at the moment. But that's great to sort of hear that feedback. And Hannah, thank you for sharing about your coffee mornings. That really does sound good, sort of 20 carers and being sort of removed from reception for being too noisy. So that sounds good. Has anyone else got any questions or anything they'd like to ask this morning? Like I say, it was just the one sort of main presentation today, and then just a sort of a little discussion sort of with Caroline and myself. But if there's nothing else that anyone would like to discuss or any questions, Karen, you're on mute.
That's it, I'm back. Interestingly, just as this was coming through, I've just had a message from one of my social prescribing clients. Is the Carer Wellbeing Fund still a thing? Or is
it is?
It is,
yeah.
okay.
Yeah.
It's very complex. She's supporting her daughter's carer, and she's a carer herself for lots of other people, and she benefited a few years ago. And she said, do I know if it's still available? I thought, that's come through, I'll ask you now. Okay, so
yeah, the process has changed slightly.
Okay.
So the carer sort of will contact sort of like they'll contact the locality team or the helpline team who will refer it through to the locality. And then we have a conversation and create a carer's star, which looks at the carer's journey where they are sort of at that particular time. That'll look at things like financing, sort of the caring role, managing sort of like their health. And then we refer it on to our carers assessment team, and they complete what they call a preventative assessment. And it's like a mini carers assessment, but it's to establish if there's any other sort of needs or anything else. And all being well, they make a decision based on that, and the money's paid. So it's changed in the sense previously we just used to fill out a form.
Yeah.
But the council have asked us sort of like to do it a different way, just so we can justify sort of how we're sort of spending the money. But
Absolutely.
yeah, that's still very much sort of happening. I've got one this afternoon, and it's always nice when you get feedback from the carers when they've been awarded. You almost want to sort of ring a bell or something to sort of, sort of say well done.
He's got a lot going on with his own mental health and physical health, and I think it feels like it would be appropriate to apply to see if there was anything available for him. That's brilliant. Thank you very much.
You're welcome. Fiona. Or was Hannah, whose hand up?
Yeah. Is that just a not gone down hand, Hannah, or is your hand up for something
No,
different?
mine hasn't gone down.
Oh,
okay.
I don't know how to get it to go down, so sorry.
no problem.
Okay, Mike, just to check with you. So is there still funding if clients are trying to get in carers respite services with an agency such as Crossroads, etc.? Can they still get that via yourselves? Might it be subsidised, or is that no longer available?
I know that they can have a carers assessment with us where they may sort of discuss sort of like the direct payments, but I probably sort of need to sort of like clarify that sort of with the carers assessment team, because we do hear about the direct payments, but because we're not sort of directly involved, I'd rather come back to you and sort of say, yes, they can still access sort of like the mini breaks and sort of things like that for respite. So I'm sorry if that doesn't really answer your question. But
actually, I can jump in on this one because I had a conversation recently about it. So we can fund short-term respite breaks, but not long-term. So if somebody wanted to put some funding towards some respite, for parent carers, for example, over the school holidays or something like that, as long as there's a kind of a beginning and an end to it, and it's not just expected to just keep paying and paying and paying for ongoing respite. We don't do ongoing, but we can do short term, just sort of one-off areas of respite.
Right. Okay.
Thank you, Caroline.
So, thank you.
Did that help? Is there any more questions? Anyone like to ask anything else? Well, all is left to say is just thank you for coming along today, and we have finished very early, so you've got the rest of the time to decide what you need to do with it. I'm sure that you've got mounds of work that you need to be doing, and but go and have a break. Go and have a cuppa or something. Well, we won't tell anyone. You're still in a training session, and this video and the information will be uploaded sort of within the next week on our website. So just to say thank you, everyone, and it's been great to see you all.